This is a clinical training series for EvolveX with the Transform applicator. Before starting the treatment, be sure to carefully read the operator manual for warnings, contraindications, indications, and instructions for use. Pre-treatment. Make sure the patient signs an informed consent form and that the patient is suitable for the treatment. Take full medical history, including any previous treatments. Do not treat a patient with any contraindications. Preparing the skin. Thoroughly clean and degrease the treatment area. Examine the skin of the patient, carefully checking the areas affected by skin laxity or any other treatable problem. Mark the treatment area on a standing patient using a makeup pencil or surgical marker. Ask your patient to lay on the treatment table in accordance with the desired area to be treated. Examine the treatment area and evaluate its dimensions and select the number of transform units accordingly, ensuring that all units fit the treatment zone. Ensure full contact of electrodes of each unit connected. Adjust belts according to patient size and treatment area. Units should be placed keeping a certain distance from each other, avoiding a mechanical collision, especially when placed in two parallel rows. Treatment procedure. Flip belt with applicator units in order to apply ultrasound gel. Apply a sufficient amount of ultrasound gel directly on the electrodes, ensuring complete coverage of all 9 electrodes. You may apply the gel onto the electrodes, the treatment area, or both. Flip belts with units back to the treatment area. Check the belt is properly inserted in the slot provided in the unit. Tighten the belts to create a firm and full contact. Arrange the units on the belts. Make sure the belt is tight enough and all units have full contact with the skin. It is recommended to apply a second belt over the units, ensuring greater contact. Connecting the cables. Available channels 1, 2, 3, 6, 7, and 8. This is a push-pull connector. In order to connect the unit, align the red dot on the connector to the red dot on the transform unit and push it in. Position the cables in a stable way, avoiding any movement of the units. In case of 2 rows on top of each other, make sure to keep a ½ centimeter to 1 centimeter distance between units. Turn on the system. Insert the code to activate the machine. The system will automatically recognize the connected transform units and will visualize them on the screen. Ensure that all units appear on the screen. You may disable and enable transform units by touching the unit number on the screen. Preheating. Adjust settings based on the parameters recommendations as presented in the operator manual and the QRG. The cutoff temperature is the temperature set by the operator and should be set to as high as tolerated by the patient with a maximum of 43 degrees Celsius. Hand the safety button to the patient. Test the safety button before the beginning of every procedure. Press Start in order to begin treatment. EMS intensity should be started at the lowest level and increased gradually every 30 seconds until reaching a tolerable level, allowing a visible contraction of the muscles with no discomfort to the patient. An initial preheat phase has a variable duration of 3 to 5 minutes. During this phase, the energy level will be kept moderate until achieving 37 degrees Celsius in all units, at least in 1 electrode. Any change of the settings during the preheating will enforce a restarting of this phase all over again. After the preheat stage, it is possible to set the parameters, making sure that the increase in temperature occurs more or less homogeneously in all units. Once cutoff temperature is achieved, the system will automatically interrupt the RF, and when moving to an adjacent area with a lower temperature, the system will automatically restart the RF again. If one of the applicators significantly delays reaching temperature, it could lead to a disconnection of the unit while the other units continue to function. In this case, check again for a firm contact of that specific unit and reactivate it by clicking on its icon in the interface. Adjusting the EMS application. Starting at level 1, increase gradually the intensity, allowing a slight increase in muscle contractile activity, avoiding any sharp contraction. The endpoint intensity level is the one that enables a visible muscle contraction with no discomfort perception by the patient. The operator should wait until reaching both cutoff temperature in all units and endpoint level of the EMS. The treatment will stop automatically when reaching the present time. The maximum duration of the EMS treatment is 30 minutes. In case of combined treatment of longer duration, the EMS function will be interrupted automatically at the end of 30 minutes. Post-treatment. Unplug the cables from the transform unit. Release the belts and remove the units. Clean the patient's skin from any remaining gel with a wooden spatula and wet wipe. Do not cool down the skin after the treatment. Some edema and erythema will show immediately after treatment and may last a few hours. It is possible to apply moisturizer immediately after the treatment. Clean units from remaining gel leftovers using a paper towel and disinfect it with 70% alcohol-soaked gauze. Treatment schedule. The number of Transform RF EMS treatments is typically 3 to 6 sessions, once weekly or once in 2 weeks, and may vary individually. More treatments and more frequent treatments may be performed according to physician discretion. For further information, please subscribe and visit InModeResources.com.